All right. Good evening, everyone. Hopefully you all can hear me all right. Please let me know if you can't, either by unmuting yourself and letting me know or typing something into the chat box. Hopefully everybody received the email that I sent out just a little while ago, about 30 minutes ago, that included the handouts and the slides for this presentation so that you can follow along. I will be covering a lot of information tonight. We're going to try and get through it as quickly as possible. I will pause at intervals during the presentation to see if anybody has any questions. And again, if you do have questions, you're welcome to either type them into the chat box and I'll address them when I pause, or at that time you can also unmute yourself and simply ask the question. And I'll be happy to answer it as best I can. Looks like we still have a couple of people trying to sign in, but I think we're going to go ahead and get started. So good evening again. Welcome. Tonight we are doing Medicare 101 Part 2. We're going to be talking about Medigap and Medicare Advantage plans, with the assumption that you have attended Part 1 that covered Medicare eligibility and benefits for Part A and Part B. Give me just a sec here. Sorry about that. All right, so let's get started. So my name is Roma. I'm with the Area Agency on Aging, and the mission of the Area Agency on Aging is to advocate to remove barriers so that people can remain independent and live in their homes for as long as possible by developing programs and systems to help with that effort. The Area Agency on Aging for the Pikes Peak region services El Paso, Park, and Teller counties of Colorado. And I am the SHIP coordinator, the State Health Insurance Assistance Program coordinator. The SHIP program is designed specifically to provide education and information on all things Medicare. Our services are free, we are unbiased, and we provide one-on-one in-depth insurance counseling to beneficiaries, family members, friends, and caregivers on all things Medicare and related to Medicare, including applying for programs to assist people who are lower on limited incomes. The SHIP program through the Pikes Peak Area Agency on Aging actually serves 9 counties in Colorado. Every county in every state should have access to a SHIP program. In Colorado, you can reach us by dialing our local Colorado Springs number or the statewide toll-free number, which I have listed on the slide. So just a quick review. Last week, we talked about Medicare eligibility, how to enroll, what eligibility criteria is, and what the benefits of Medicare Part A and Medicare Part B are. Medicare Part A and Part B are considered your original Medicare benefits. Tonight, we're going to talk about options to go with your original Medicare benefits. There are 2 primary types of coverage that you can look at to go with your original Medicare. We are going to talk about Medicare Supplements, also known as Medicare Advantage plans, and we're going to talk about Medicare, we're going to talk about Medicare Supplements, also known as Medigap coverage, and we're also going to talk about Medicare Advantage plans, also known as Medicare Part C. These are the options that are available to anybody who is enrolled in original A and B of Medicare. Both of these options are regulated by Medicare, and there are limited timeframes in which you might be able to enroll. We are going to start with talking about Medigap, or Medicare Supplement coverage. Medigap and Medicare Supplement are 2 terms used for the same thing. They both refer to the same kind of coverage. So what is Medigap? Well, basically Medigap insurance or Medicare Supplement insurance is a private insurance policy purchased from a private insurance company, but it is solely and specifically designed to supplement the costs that Medicare A and B left over after they paid their part first. Let me say that again. Medicare Supplement insurance is a private policy you purchase from a private insurance company, and it is solely and specifically designed to supplement or pay the balance that Medicare left over after Medicare Part A and Part B paid their part first, period. Even though they're private policies sold by private companies, they are still required to follow all state and federal laws that are designed to protect you. If you purchase one of these policies, the policy itself must say Medicare Supplement Insurance, those 3 words in that order. The phrase Medigap, or the term Medigap, comes from the thought process that it covers the gaps in your original Medicare coverage of A and B. Medicare Supplement insurance is standardized, which means there are a limited number of policies to choose from, or levels of coverage to choose from. They're labeled A through N like the alphabet, with the exception of 3 states that have an additional couple of options or levels of coverage to choose from. But because they're standardized, meaning all companies sell all of the same plans or levels of coverage, what you look at when you're looking at Medicare supplements is how they vary by cost, by the level of coverage or plan, and where you live. So how do they work? Well, Medicare supplements, or Medigaps, only work if you have original Medicare A and B. In fact, you have to have original A and B of Medicare in order to enroll in one of these plans. If you have other types of coverage, such as you're already enrolled in a Medicare Advantage plan, or you have other credible coverage, such as if you're retired military, you have access to TRICARE for life, or even if you are retired through a private or public employer, you may have access to retirement benefits through that employer. In those situations, you would not necessarily need a Medicare supplement or Medigap. If you purchase a Medicare supplement or Medigap, again, original Medicare A and B is your primary coverage, and the Medigap or Medicare supplement is designed to basically act as a secondary or supplement coverage to A and B. Because A and B is your primary coverage, you can go to any doctor, provider, hospital, or otherwise that accepts original Medicare anywhere in this country. And as long as Medicare pays their part for those services with those providers, the supplement will pay the balance. So for people who tend to travel a lot, it is probably the most portable option that you can enroll in, because you don't have to worry about networks or service areas, because it's good anywhere in the country with any provider that will accept it. So again, who can buy the Medigap or Medicare supplement? Anybody who is currently enrolled in original A and B of Medicare. But again, you do have to have both A and B of Medicare to be eligible to enroll. And there are specific timeframes that you want to be aware of, which we will talk about in detail, so that it's easier for you to enroll. The primary timeframe you need to talk about is called guarantee issue period. If you try to enroll outside of a guarantee issue period into a Medicare supplement, you may have to answer healthcare questions on the application and do what's considered go through the underwriting process, which means the insurance company can review your medical history. And if they don't like what they see, they don't have to sell you insurance. In the state of Colorado specifically, we also have a law that guarantees people who become eligible for Medicare who are under age 65 the ability to purchase a Medicare supplement during their guarantee issue period. Premiums for people who are under 65 do tend to be higher, basically because if you're under 65 and on Medicare, then the likelihood of you having a pre-existing health issue is much stronger. So they will and are allowed to charge slightly higher premiums. But even in that situation, if you're under 65 on Medicare, you purchase a Medicare supplement at a higher premium. When you turn 65, you can purchase a supplement again with guarantee issue and get a lower premium. And we will talk about that in more detail. So again, the best time to buy a Medicare supplement or Medigap is basically going to be during your guarantee issue period, which is also sometimes referred to as the Medigap open enrollment period. This enrollment period lasts for a total of 6 months, and it starts at the same time your original A and B of Medicare start. So both A and B have to be in effect for you to be eligible to buy this coverage. So let's say you enrolled in Medicare Part A 6 months ago, a year ago, 2 years ago, but you delayed enrollment into Part B because you were working or something like that. When your Part B goes into effect, that's when your guarantee issue period starts. So it is going to coincide with the start date of having both A and B in effect, whether it's at the same time or whether or not it's a delayed enrollment into Part B. And that 6 month window, once that clock starts ticking, it can't be stopped. But during that 6 month window, what that gives you is guarantee issue. And what that means is you would be allowed to purchase a Medicare supplement policy from any company, any level of coverage you want, without any question, without any underwriting, without any pre-existing condition clauses. You're guaranteed to get whatever level of coverage you want from whatever company you want with no questions asked, as long as you get it within that 6 month window of guarantee issue when you first become eligible or enrolled in Medicare. Once that guarantee issue period expires, you're likely not to get another one, except in very special situations or what's considered a special enrollment period. Special enrollment periods are going to involve, like we talked about last week, maybe any type of loss of other coverage. So anytime there's any involuntary loss of other coverage. So for example, if you have original A and B of Medicare and you've been using your previous employer's retirement benefits, they offered retirement healthcare package, you took advantage of that, that healthcare has been coordinating with Medicare and providing benefits after Medicare. But say that employer suddenly decides that that's no longer a cost-effective option for them and they've decided to stop covering retirees through healthcare. In that situation, because that retiree coverage had been providing coverage coordinating with Medicare, when that coverage ends, because that is ending involuntarily, you would have a guarantee issue into a Medicare supplement at that time. And that would be considered a special enrollment event and provide you a special enrollment period. So anytime there's any sort of what's considered involuntary loss of other credible coverage, whether it be retirement healthcare, COBRA is credible coverage, active employer coverage is considered credible coverage. Using the test drive, if you get into a Medicare Advantage plan, which we'll talk about next, is considered credible coverage. Anytime you have a situation where you're losing other coverage that's been coordinating with Medicare involuntarily, that provides you with a special enrollment period. That special enrollment period that provides you that additional guarantee issue or a new guarantee issue into a Medicare supplement will typically last anywhere from 63 days to 6 months, depending on the situation. As with Medicare, there are some things that a Medicare supplement policy will not pay for, and that's going to include the same things that Medicare will not pay for, such as long-term care services, vision or dental care, hearing aids, private duty nursing, and of course, outpatient prescription drugs, because that's going to be covered under Part D, as in drug. In the email that I sent you earlier, about 45 minutes ago, there was a couple of handouts that pertain specifically to Medicare supplements. Before we get into talking about those, I'm going to pause for a moment to see if there are any questions. Again, if you have a question, you can either unmute or you can type the question into the chat box and I will address it.
Yeah, I had a question.
Yes.
On the Medigap open enrollment period, that was what, 6 months?
Correct.
Okay, see, the contradiction I'm having, I registered for A and B back on my birthday.
Okay.
And it says my Part B doesn't start till August 1st, 2021, whereas my Part A started the month of my birthday. So is that 6 months for the Medigap measured from August 1st? Or when is that exactly measured from?
So without knowing what month your birthday is in or why they would have delayed that Part B start date.
I never understood that to begin with. My birthday was in February of this year.
And that's the month you enrolled?
No, I didn't enroll till the 1st of April.
Okay, that would be why.
Okay.
Because when you delay enrollment past the month of your birthday, there's a delayed start in your benefits. That still doesn't explain why August is your start date for Part B, but you know, I might encourage you to contact me after the presentation at some point to talk about that in a little more detail. But the bottom line to answer your question is because you have to have both A and B of Medicare to enroll in a Medigap, that 6-month guarantee issue period doesn't start until Part B goes into effect. So
Okay, and that's what I wanted to clarify.
Yeah.
Thank you.
You're welcome.
So that's not till August.
I have a question.
Yes, ma'am.
As we go through this, could you compare how para fits into the whole scheme as we go through this presentation? Thank you.
Okay, so well, let's talk about para real quick. Well, no, let's wait to talk about para. Let's talk about
Thanks.
Medicare supplements first. And I might even wait to talk about para until after we talk about Advantage plans so that you guys have the foundation to understand the difference between these options and how para works. It'll be easier to compare the two. So don't let me forget to do that. But yeah, we can definitely talk about para. Any other questions? Okay. So again,
Yes, I wanted to ask. I'm Bob, and my question is on the 2021 standardized Medicare supplement plans. Across the top are the different plans and basic benefits. Then right below that is skilled nursing facility co-insurance, and then there's some other things under Plan K and Plan L about out-of-pocket limit of. I don't understand any of those things. So at some point, if you could discuss them, that would be very helpful, please.
Actually, we're going to talk about that right now.
Oh, okay, super.
So based again, in the email that I sent earlier, there was a couple of handouts. This is one of them. This handout outlines the 10 different levels of coverage that you have to choose from, or the 10 different types of policies that you can purchase as a Medicare supplement. These are the levels of coverage that all companies sell. These are the standardized plans or levels of coverage based on federal regulation. So these are the 10 levels of coverage you have to choose from no matter what company you purchase them from. They are all selling you these plans. These plans, again, they're labeled A through N like the alphabet. And yes, I know there's a gap in the alphabet, but that's because there used to be plans labeled A through J. And several years ago, Medicare decided to drop H, I, and J. And instead of just replacing H, I, and J with different benefits, they just kept going on up the alphabet. So that's why their alphabet is not exactly in order. We're going to talk about the benefits for each of these plans. Again, these plans are labeled by alphabet letter. So when you're looking at purchasing a Medicare supplement, how good your coverage is based on the level of coverage that you purchase. And the level of coverage you purchase is what's going to determine how much that policy pays after Medicare has paid for something first. So we're going to talk about these plans. You'll notice that on this chart, all plans, so each benefit for these plans is listed under the plan letter designation. So for example, Plan A, under Plan A, in the box under Plan A, there's only one box filled with basic benefits. But you'll notice all plans include basic benefit coverage. Basically, what basic benefits provides is coverage for the other 20% that Medicare left over after they paid their part first for Part B services only. So if you purchase Supplement Plan A, that is all the coverage you are going to get, is it will pay the other 20% that Medicare left over for Part B services only. It will not pay any deductibles for A or B or any other expense. Under Plan B Medicare Supplement, it covers basic benefits. And again, this is at 100% after Medicare pays their part. So it pays the 20% balance at 100%. It also covers the Part A inpatient hospital deductible every time you're admitted to the hospital. So if you purchase Supplement Plan B, you get basic benefit coverage. You get your hospital deductible covered every time you're admitted. I'm going to skip to Plan D. Plan D covers basic benefits, covers the hospital deductible every time you're admitted. It also covers the skilled nursing facility coinsurance. So if you remember from last week, if you have a hospitalization of 3 days or more, and then the doctor discharges you into a skilled facility for rehab or recovery, Medicare pays 100% for the first 20 days of that skilled facility stay. But then starting on day 21 of that facility stay, Medicare starts applying a daily coinsurance. Again, this year, that daily coinsurance, starting at day 21 of your facility stay, is $185.50 per day. If you purchase a supplement plan that includes a skilled facility coinsurance benefit, that plan pays that $185.50 per day. So if you purchase a Plan D, you're getting basic benefit coverage at 100%. Basically, the other 20% Medicare left over is paid in full. The hospital deductible is paid in full every time you're admitted. And if you are admitted to a skilled facility, it covers everything after the first 20 days up to day 100. This plan also has a provision at the bottom for foreign travel emergency. Now, Medicare, as we know, does not provide any coverage outside of the United States of America and or our territories. Coverage stops at the border. What the supplement policy can provide is not actually insurance coverage if you have foreign travel. If you tend to, or if you happen to be traveling outside of the US or our territories in a foreign country, and you have a medical emergency while you are in that foreign country, of course, Medicare is not going to pay for it. You are typically going to pay for that medical emergency at the time of that emergency. When you get back home, you can submit that bill or that receipt for that medical emergency you had in a foreign country to your supplement. The supplement will immediately turn around and say, you have to bill this to Medicare for a denial. So they're going to make you bill Medicare directly so that they can prove that Medicare is going to not deny paying for that service. You submit that bill again, you submit the Medicare denial again back to your supplement, and they should reimburse you 80% of the cost of that foreign emergency after a $250 deductible. So it's not actual medical insurance if you're traveling in a foreign country, but it can potentially be reimbursement if you have a medical emergency in that foreign country when you get back home. It can be a long drawn out process and they don't make it easy, but it is, as long as you can jump through the hoops, they will reimburse up to 80% after a $250 deductible. But keep in mind, it's not foreign travel insurance. And there are several policies or levels of coverage that provide that provision. If we jump over to Plan G, as in goat, this plan is currently probably considered the Cadillac level of coverage for Medicare supplements. It includes that basic benefit, includes that skilled facility coinsurance, the Part A hospital deductible, the foreign travel emergency clause. It also covers what's called Part B excess. Part B excess refers to how Medicare providers get paid, how Medicare Part B providers get paid. And there are basically two ways Medicare looks at Part B providers, which are basically going to be your primary doctor, your specialist doctors, your Part B service providers. When you have original Medicare as your primary insurance, there are basically two ways doctors can get paid. The first way a doctor can get paid is what's called on assignment. So for example, let's say you go to your primary doctor for a regular office visit. And that doctor typically charges someone walking in off the street $300 for an office visit, cash money. But you have Medicare. So you go to that visit, the doctor is going to bill your Medicare, their retail or cash money price of $300. Medicare is going to turn around and say this type of office visit is only worth $100. And Medicare is going to pay 80% of $100. The supplement will be billed the other 20% or $20. They will pay the $20 balance. So between Medicare A and your Medicare Supplement, or Medicare Part B and your Medicare Supplement, the doctor will get paid a total of $100. In that situation, that doctor accepts Medicare assignment. So he accepts whatever dollar amount Medicare assigns for that service as payment in full. In that situation, Medicare pays that doctor directly. When you go for the office visit, you show them your Medicare and your supplement card. You should not have to pay anything at the time of service. Medicare will pay them directly. The supplement will pay them directly. The other $200 of that $300 that provider actually billed Medicare has to be written off like it never existed. So even though the doctor thinks that that service is worth $300, quite honestly, that doctor knew Medicare was only going to pay them $100 or allow them to get paid $100. And they were okay with that. That doctor accepts Medicare assignment. When a doctor does not accept Medicare assignment, it basically works the same way. You go in for an office visit. That doctor is going to bill Medicare $300. Medicare is still going to turn around and assign $100 for that service and pay 80% of that $100. The $20 balance will be billed to the supplement. The supplement will pay the $20 balance. However, when a doctor does not accept assignment with Medicare, that doctor is allowed to charge a little bit more. So even though that doctor doesn't take assignment, that doctor knows Medicare is going to limit them to $100 total, but non-assigned doctors are allowed to charge you 15% more than that. And typically that doctor is going to ask you to pay that whole amount up front. So when you go to your office visit, that doctor is going to ask you to pay $115 up front for your office visit. They're still going to bill Medicare. By federal law, they're required to bill Medicare for you. But when Medicare gets that claim, they're going to see that that doctor does not take assignment, and Medicare is going to assume you've already paid the doctor up front. So when Medicare processes that claim and pays 80% of that $100, they're going to send you a check for $80. When they send that over to the supplement and the supplement processes the other $20, the supplement's going to send you a check for $20. That extra 15% or extra $15 that you paid up front is called Part B excess. That Part B excess is typically not reimbursed unless you have a supplement plan that includes that Part B excess benefit. So if you were to enroll in a Plan G supplement, not only would Medicare pay their 80%, the supplement would pay the other 20% under basic benefits, but it would also pay that extra $15 you paid up front. Now in the Colorado Springs metro area, that is not typically an issue. Most doctors who take original Medicare as a primary insurance in this area take assignment. There are a couple of doctors that don't. And it might be more prevalent in other areas of the country or in other states, or even in other parts of this state. But in our area specifically, it's not as common as it might be in other areas. Whether or not that is a benefit that you would find advantageous to have. Certainly, if you do intend to travel a lot once you're retired or whatnot, that might be something you look at keeping as part of your coverage, just because you don't know what other states' providers are doing. When we start looking at the rest of the plans, K, L, M, and N, plans K and L specifically are designed to pay many of the same benefits, but at a lesser amount. So you'll notice Plan K pays hospitalization and preventive care at 100% because they have to by law. But the other basic benefit coverage, they only pay at 50%. So that $20 balance left over in that last example, they'd only pay half of that. They only pay half of the skilled nursing facility coinsurance of $185.50. They only pay half of your hospital deductible every time you're admitted. Because that plan pays less than 100% after Medicare or the balance Medicare left over, it does have a maximum amount of pocket per year. For 2021, that max out of pocket is $6,220. Once that deductible is met, meaning just the 50% they didn't pay goes towards that out-of-pocket limit. If you were to reach that out-of-pocket limit within a calendar year, however much time is left in the year, that plan would have to pay 100% after Medicare. For Plan L, same thing, except that Plan L pays a little bit more. They pay 75%. You only have to pay 25%. The out-of-pocket limit, because the Plan L pays higher amounts, is $3,110 for the year. The premiums for these two plans are significantly lower than the premiums for some of the other plans, simply because of that lower benefit that they pay out. When we start looking at Plan M and N, Plan M is pretty basic. It pays 100% for Part B services that Medicare left over. It pays 100% for the skilled nursing facility coinsurance, that $185.50, but it only pays half of your inpatient hospital deductible every time you're admitted, although it does have that foreign travel emergency clause. Plan N has actually become rather popular with a lot of people. Plan N does pay basic benefits at 100% for everything except office visits of any kind or emergency room visits. For those two services specifically, Plan N requires that you pay a $20 copay if it's an office visit of any kind, or a $50 copay if it's an ER visit at any time. After that, they do pay 100% for all other services under Part B, and 100% after that copay for Part B services. Otherwise, that plan pays 100% of your skilled facility coinsurance, pays 100% of your hospital deductible every time you're admitted, has the foreign travel emergency clause. These are the standardized plans. These are the levels of coverage you have to choose from. There are two plans that I skipped over and are in shaded boxes, Plan C and Plan F. Plan C and Plan F are only available for purchase to people who were originally eligible for Medicare prior to January 1st of 2020. If you are eligible for Medicare at any time after January 1st of 2020, you cannot enroll in a Plan C or F. But if your eligibility, whether you enrolled or not, if you were eligible for Medicare prior to January 1st of 2020, you would still have the option of potentially enrolling in Plan C or F. Basically, the only difference between Plan C and Plan D, which is its equivalent now, and Plan F and Plan G, which is the Plan F equivalent. The only difference between those plans is that Plans C and F also include the benefit of the annual Part B deductible being covered, where Plans D and G do not. The reason Plan C and F is no longer available for purchase for anybody whose eligibility was after January 1st of 2020 was because they included that Part B annual deductible benefit. That Part B annual deductible benefit, specifically under Plan F, basically, if you could purchase a Plan F and have Medicare A and B, you basically have 100% health insurance coverage for anything medical that you needed. And unfortunately, that was considered too good. Under the new laws of healthcare, and just in the last couple of years, Plan C and F were removed from as an option because of that Part B deductible, because it provided what they call first dollar coverage, because it covered both your Part A and Part B deductibles. And basically the government wants us to pay more out of pocket is what it kind of boils down to. So again, unless you are eligible for Medicare prior to January 1st of 2020, those two plans are not even an option for purchase for you. I will pause there and see if there are any questions about any of that. That was a lot of information. Does that make sense? Is it clear as mud? All right, I'm not hearing any questions, so we will move on. So again, these are your standardized plans to choose from. You can choose from any and all of these plans, except of course C and F, unless you were eligible prior to 2020, during your guarantee issue period, that 6-month window. You can choose from any and all of these plans, enroll with any company with any of these plans that they offer, no questions asked. It looks like I do have a question in the chat box. Can you switch plans at a later date? So here's the kicker when it comes to Medicare supplements. Medicare provides you with that 6-month window of guarantee issue for a reason. That 6-month window of guarantee issue allows you to purchase any level of coverage from any company you want with no questions asked. No insurance company can turn you down based on any pre-existing health issues you have. Once that 6-month window of guarantee issue stops or ends, it's gone. And if at any time, outside of a couple of special opportunities that we will talk about again in more detail, anytime you could try to switch from one company to another, or even from one plan level to another within the same company, if you are not in a guarantee issue period or in a special enrollment period that provides guarantee issue, you are subject to underwriting. So what that means is if you have pre-existing health issues, the likelihood of you being allowed to switch to a different plan can become pretty small, because they will look at your health history. If they don't like what they see, they will not sell you coverage or not let you change that coverage within the same company. It's not going to be a matter of, oh, we'll sell it to you, but we're going to charge you twice the price. It's typically all or nothing, yay or nay. If you're healthy and you can pass underwriting, which means you answer the healthcare questions on an application and they're okay with those answers, you can switch plans or companies as often as you like, because you're going to pass underwriting with those companies. They're not going to have any issues with your health history. But once you develop a health history or develop health issues that are going to be considered high risk, meaning they're going to have to pay money out in all likelihood, they're less likely to want to let you do that. So the bottom line is, especially for people with pre-existing health issues, that guarantee issue period to purchase this kind of coverage can be very, very important, because it may be the only opportunity you have to purchase this kind of coverage if you have those pre-existing health concerns. But again, if you're healthy when you apply or try to switch to a different company, you can do that as often as you like. There is no annual enrollment period for Medicare supplements. There is no open enrollment period outside of your guarantee issue. So there's no annual opportunity to switch plans. It's once you're in, you're in. Once you're out, you could be out. Is basically how these work. I've also gotten questions in the past that, how can they do that with the Affordable Care Act and no underwriting? They have to sell insurance to everybody. The bottom line is, unfortunately, the Affordable Care Act rules do not apply to Medicare. So these plans are allowed to do that. So
Could I ask-
go ahead.
Oh, I just wanted to ask, at some point, could you talk about some of these plans and the other plans through the evening, through this meeting, in regards to physical therapy and rehabilitation?
Related specifically to supplements? Just to clarify it, do you want me to talk about how that benefit is covered specifically by supplements? Yes, no?
I guess I was muted. Yes, please.
Okay. So the bottom line is, when you have original Medicare and you have need of a medical service, or you have a medically necessary need for a service, as long as the doctor establishes medical necessity with Medicare and Medicare pays their part, the supplement pays the balance. It doesn't matter what that service is or, why you're getting it, as long as the doctor can tell Medicare it's for a medically necessary reason. So the rule of thumb for Medicare, whether or not they're going to pay for anything, is that medical necessity. As long as the doctor says you need to have something done, and that doctor is going to tell Medicare, yes, this was medically necessary to have it done, Medicare will pay for it. As long as Medicare pays their part, the supplement pays the balance based on whatever level of coverage you choose. So again,
Does that
Go ahead.
also apply to durable medical equipment and like ostomy supplies and things like that?
absolutely. Anything Medicare A or B covers, as long as Medicare pays their part first, the supplement pays the balance. So durable medical falls under Part B services technically. And as long as Medicare pays their part for those services or supplies, supplement pays the balance. Now, when it comes to durable medical supplies like ostomy and stuff like that, there are some durable medical providers that do not take assignment, and that might be a little more common than with other types of providers. So that might be a question you need to ask a provider if you currently are using one, as to whether or not they accept what Medicare pays them, or whether or not they're going to charge you a little bit more than what Medicare pays them, because there are some providers with some certain supplies and services that fall under durable medical that are allowed to do that. But again, if you got, say, a supplement plan G with that Part B excess benefit, whatever you paid up front would typically be reimbursed at 100%. But yeah, rule of thumb, if Medicare pays their part first under A or B, as long as Medicare pays their part first, the supplement pays the balance. Now, on the flip side of that coin, if Medicare decides not to pay for something, the supplement will pay nothing either. So if Medicare denies a service or decides it wasn't medically necessary, your supplement is not going to pay anything either. Because again, it's only designed to pay the balance that Medicare left over after Medicare paid first. It's not designed to pick up if Medicare doesn't pay. So it's only there to supplement Medicare A and B after they do their part first. Another quick question, does the annual enrollment apply to Medigap insurance? Can I reselect during an open enrollment period? Again, no. There is no annual enrollment period for Medicare supplements. Once you're in, you're in. Once you're out, you're out. That's why you're given that 6-month window of guarantee issue, so that you have an opportunity to get into this kind of coverage regardless of any pre-existing health issues without question, as long as you do it during that guarantee issue period. But once that period expires, unless you fall under some other special enrollment opportunity, you're always subject to underwriting, and that's the key to whether or not you can get into this kind of coverage at any time. So again, you can purchase this coverage any time of the year. There's no annual opportunity. There's no annual time frame that you have to worry about, just that initial 6-month window of guarantee issue. Or if you lose other credible coverage, you might have a special opportunity of guarantee issue, which we will talk about a little bit more as it relates to Advantage plans. The other handout that I emailed you all regarding Medicare Supplements is this publication. This is put out by our Division of Insurance up in Denver. We are very, very lucky in the state of Colorado that this, our Division of Insurance puts the time and effort into putting this publication together, because I don't know of any other state off the top of my head that actually provides this kind of information to its residents. This handout is specifically going to provide you with information by listing all of the companies that are licensed to sell Medicare supplement insurance in the state of Colorado. But it does go one step better than that. Not only does it list all the companies licensed to sell this coverage in Colorado, and there are probably over 40 of them in Colorado alone, but when you get halfway through this handout, it's going to give you that list of providers. It's going to give you their phone numbers to call to enroll or get more information. It's going to have across the top the A through N, which is going to represent the plan levels that we just looked at on that chart. Each page is going to have at the top an age designation, and this didn't translate very well when I converted it from Word to PDF, but that should say age 65. So each page is going to say age 65, and then it's going to go up to another age group. Age 70 is the next page. Age 75 is the page after that, 80. And then once you get to age 85 or 80, it stops and goes to disability age. So it's in five-year increments. Each page is going to list all the insurance companies licensed to sell coverage in Colorado in alphabetical order, front to back of each page. So this is the front side of page for age 65. If you go down the list and you're looking at any of these particular insurance companies, we'll look at, we'll look at Cigna, for example. If you go down to Cigna and you go across the page and say you are looking at purchasing a Plan G, if you go across the page to the column of Plan G, if there is a number in that box where Plan G and Cigna meet, that number does represent an approximate monthly premium for that plan with that company for that fiscal year. Now, having said that, this is going to give you a ballpark idea of how much plans are going to charge, or how much insurance companies are going to charge for the plans that they sell based on your age group. This handout is not designed to give you exact price quotes, because first of all, this handout is usually updated in the summertime. This actually was updated a little bit late last year because of the pandemic. It usually comes out in July. And I do anticipate it coming out in July, by the end of July for this year. But it comes out in the middle of the year, and plans do tend to change their premiums at the first of the year. Also, it's going to give you generalized information because there are a lot of different factors that go into a company determining what their premium rates are going to be for any particular area. So premiums can vary based on zip code. And on this handout, the zip code they used for these averages is 80202, a Denver zip code. Denver does tend to pay slightly higher premiums than we do in El Paso County. So again, these are not designed to give you specific price quotes, but give you a ballpark idea of where they sit. Prices also can vary between men and women. Women tend to pay slightly lower premiums than men because statistically we stay healthier and live longer. Premiums can also vary based on, your specific age. So these are in 5-year age groups, but some companies base the premium on your exact age of 66 or 67. So there are a lot of factors that can go into how a company determines their specific premiums for the plans that they sell for any particular person based on those different factors. Now, they cannot base their premiums on you specifically. They cannot base their premiums on how you answer the health questions on your application, especially if it's during open enrollment or your guarantee issue period. And once they've determined premiums for the different categories that they offer, those premiums are set for a year. So they cannot single anybody out on the premiums. The premiums cover all of Colorado for people who fit into those different categories. So again, these are ballpark price quotes, but it's going to give you an idea of what companies charge less and what companies charge more. Again, they're all selling you the same plans. So no matter who you buy it from, a plan G is a plan G is a plan G, as outlined on this chart. No company can alter these plans in any way. They can't add coverage. They can't subtract from the coverage listed. They cannot change them in any way. So they're set in stone. So any company that sells a plan G sells exactly as it's outlined. Because they're all selling you the same product, it does pay to shop around. If you go down this plan G column, you're going to see premiums listed that can be quite a bit different from one company to another. For example, if we look at AARP at the top, plan G for a female averages $120 a month. But if you go just a couple of lines down, plan G with American Financial, $171 a month. Go a few more lines down, Everence Association, $193 a month, $212 a month. So it really does pay to shop around. Just because a company's charging a higher premium does not mean they're going to provide you anything better. Does not mean they're going to have better customer service, does not mean they're a better rated company, none of that. It simply means that that's how the company, based on whatever convoluted formula they use to make those determinations, that's what this company decided to charge for our specific area or our age group. So again, premiums are not reflective of customer service. They're not reflective of company stability. But those may be some of the questions that you ask these companies. What this handout is designed to do is help you narrow down the list of companies that you might actually want to inquire with directly. There is no advantage to paying a higher premium for any of these plans with one company when you might be able to get it from another company for much lower premium. It does pay to shop around, especially while you're in guarantee issue, because you're going to be in what's considered a preferred pricing category, where you're going to get the best deals available. So this is designed to be a tool to help you decide what companies you might actually want to have further conversations with. It's not designed to give you specific premium information. Now, if you're becoming eligible for Medicare or have become eligible for Medicare anytime in the last 6 or 9 months, I'm sure you've been inundated with junk mail. Junk mail, junk emails, phone calls, probably, God knows. If you're getting junk mail from any of these companies that are selling actual Medicare supplements, in that information that you're being sent, it might actually have an exact premium quote for you in that material. The best way to tell if you're getting information from a company trying to sell you Medicare supplements is it will have in that material usually some form of this chart. And if it has some form of this chart or some version of this chart with prices listed, that would be an exact price quote for that company with the plans that they offer. Otherwise, you would probably have to call the companies directly to get an exact price quote for you, for your situation, your age. So any questions about any of that? And do you have a question? How do you know if doc is available?
Yeah, that was me. Mhm.
If
I
doctors
hear-
are available?
Yeah, because I've heard it's a problem finding a doctor that takes Medicare.
No, typically, you know, certainly it's a little harder to find a doctor that will take Medicare or Medicare patients with any kind of insurance versus doctors that just take anybody. And that's always been a concern for the 20 years I've been doing this. but it's not hard to find a doctor that takes Medicare, original Medicare with a Medicare supplement or just original Medicare. There are plenty of them out there. If you have a current medical provider or current primary care doctor, then you are certainly going to want to ask that primary care doctor if they will be able to keep you once you transition into Medicare. Most doctors will, some doctors will not. If you don't currently have a doctor because you've been waiting to get Medicare before you really started, dealing with going to a doctor, typically my office does provide a handout where, in the past, we've updated a list of doctors that are taking new Medicare patients when original Medicare A and B is your primary insurance. And I've maintained this list for like 15 or 16 years. I've tried to update it every 6 months. Unfortunately, due to the pandemic, I've not been able to update it for quite some time, but it is still a relevant list if you need a place to start. It's going to be a list of doctors in the Colorado Springs, all the way out to Falcon, Woodland Park, kind of divide even, I think, list of providers that were taking new Medicare patients at the time it was updated. That list of doctors doesn't change very often, so it's usually the same groups and the same doctors who are going to continue to take new Medicare patients on a regular basis. So it can still be a good reference to give you a starting point, and I'm happy to email that to you if you'd like. I'll provide my contact information at the end of the presentation, and just let me know if you would like that list, and I will be sure to get it emailed to you. Otherwise, we are going to start trying to get it updated for 2021 sometime in July. So just FYI. Other than that, unfortunately, if you don't already have a doctor as a place to start, I don't want you to feel like you just have to start open up the yellow pages and start going down the list, because that can get pretty frustrating pretty quickly. You can also go to Medicare.gov, and they do have a provider search function that would be able to give you a list of doctors based on zip code radius kind of thing. How often they update that list on the Medicare.gov website, I'm not 100% sure. At least once every 6 months, I think. But yeah, I'm happy to provide the list that I have. And again, I'm hoping to be able to update that now that things are returning to normal sometime in July. And yes, I will put you on my list. I will get that emailed to you, my dear. Any other questions before we move on? I know we're running a little bit behind, so I'm probably going to try and scoot through this next set of information pretty quickly. All right, so if there's no other questions about Medicare supplements, that's basically supplements in a nutshell. And now we're going to move on to Medicare Advantage plans, which can be a little more confusing. Medicare Advantage plans are obviously your other option for coverage to go with your original Medicare, but it's an option that works completely differently than Medicare Supplements or Medigap. Medicare Advantage plans are basically plans, they are insurance companies that have contracted directly with Medicare to act on Medicare's behalf. So when you enroll in a Medicare Advantage plan, you're enrolling in a plan with a private company, but that company has contracted with Medicare, and Medicare is going to pay them to act on their behalf. What that means is when you enroll in an Advantage plan, that Advantage plan becomes your Medicare. You still have original Medicare, even though you enroll in an Advantage plan. Your original A and B will always be there in the background, and you will still have to pay your Part B premium. But once you enroll in that Advantage plan becomes your primary provider. They are the ones who are now in control of any benefit that Medicare would cover under original Medicare. And they are who you get those benefits from or through. That insurance company is who pays the providers for the services that you need. Because these companies contract directly with Medicare, you are still given all the rights and protections of original Medicare. They still have to follow all the rules and regulations at federal and state levels. They still have to provide any and all types of services that original Medicare would provide for. But these plans are referred to as Advantage plans because they may provide the advantage of some extra benefits that maybe original Medicare does not cover, such as routine vision services, hearing services, dental care. Free gym memberships were the big thing, a couple years ago. So all of those kinds of things that original Medicare currently doesn't provide for, you may be able to find through an Advantage plan on a limited basis. And Advantage plans usually will include Part D prescription drug plan as part of the package, included into the package at no extra cost. When you have original Medicare and a Medicare supplement, you have to buy Part D separately on top of that. When you have a Medicare Advantage plan, instead, you could probably get that Part D coverage included at no extra cost. And that is the other big advantage of Advantage plans. There are some additional eligibility requirements to enroll in an Advantage plan. Primarily, that's going to be that you have to live in that plan's service area. And for all intents and purposes, that is going to be the county you reside in. So you have to live in the county that the plan is being sold in. You have to buy a plan that's being sold in your county of residence. Again, you have to be enrolled in both A and B of Medicare, and there are limited timeframes which you can enroll, but there are more timeframes that you can enroll or make enrollment changes throughout the year versus Medicare supplements. So for those interested in Advantage plans, enrollment periods are a little bit different. You can enroll into a Medicare Advantage plan during what's called the initial enrollment period. The initial enrollment period is going to be the same initial enrollment period timeframe as when you first become eligible for Medicare at age 65. That's going to be the 3 months prior to the month of your 65th birthday, the month of your 65th birthday, and up to 3 months past the month of your 65th birthday. That is the time frame you can enroll in an Advantage plan without penalty or having to wait for the next enrollment period. But there are, again, additional enrollment periods that you might be able to take advantage of. There's the annual election period, also known as open enrollment, which happens in the fall. There's the new annual Medicare Advantage open enrollment period, which happens in January through March. And then there's always special enrollment periods for situations where you have involuntary loss of other coverage. The annual election period, which again is also referred to as open enrollment each year, is the longest running enrollment period. This is October 15th through December 7th every year. During that time frame, you can decide if you want to get into an Advantage plan or Part D plan, get out of an Advantage plan or Part D plan, or switch from one Advantage plan or Part D plan to another. Any decision you make or any change you make during that time frame goes into effect January 1st. You can also choose to get out of an Advantage or Part D plan altogether. And if you get out of an Advantage plan, you go back to original A and B of Medicare that never went away. And that would be effective again January 1st. The newest open enrollment period for Advantage plans, the Medicare Advantage open enrollment period, runs after that. So the Medicare Advantage open enrollment period runs from January 1st each year through March 31st. For that enrollment period, this enrollment period only applies to people who are enrolled in a Medicare Advantage plan as of January 1st each year. So even if you're enrolling in an Advantage plan for the first time ever, because that plan goes into effect January 1st, you can take advantage of this enrollment period. Or if you've been in an Advantage plan for years, you can take advantage of this enrollment period. If you're in an Advantage plan as of January 1st, you have another 3-month window to decide if you want to stay in the plan that you're in or switch to a different Advantage plan, or get out of Advantage plans altogether and go back to original Medicare. If you are not enrolled in an Advantage plan on January 1st, this enrollment period does not apply to you. There's nothing you can do. If you're in an Advantage plan and you choose during this enrollment period to go back to original Medicare, when you drop that Advantage plan, you are going to be able to enroll in a separate Part D plan if your Advantage plan included Part D coverage. But again, if you're just in a Part D plan during this time frame, this enrollment period does not apply to you. You cannot do anything. Then, of course, there are special enrollment periods. There are always special enrollment periods with it when it comes to Medicare coverage. For any situation where you suddenly become involuntarily losing coverage. So Medicare's point is that they never want you to be in a situation where you are uninsured or uninsurable through no fault of your own. So anytime there's involuntary loss of any sort of other coverage that you've had to go with original Medicare or whatnot, anytime you have involuntary loss of coverage, Medicare is going to make sure you have a window of opportunity to get into something else. Special enrollment periods apply to Medicare Advantage plans in situations where you move out of the plan service area. Again, with Advantage plans, you have to purchase a plan that's available for sale in the county you reside in. If you move out of that county, you cannot take your plan with you because it's only good in that county. So if you leave your county, whether it's moved to another part of the state or another state entirely, because you can't take the plan with you, it's considered involuntary loss. It wasn't your fault. And that would provide you a special enrollment period. That special enrollment period would give you an opportunity to either get into another Advantage plan when you get to where you're moving to, or B, guarantee you issue into a Medicare Supplement when you get to where you're going to. Again, those are going to be short windows of time to take advantage of that special enrollment period, but it does give you guarantee into those scenarios. The other way it might happen is if you're in an Advantage plan and that plan decides to leave your county, which happens. So if you're in an Advantage plan, that plan decides it's no longer financially viable for them to stay in that county, they can choose to pull out. And again, involuntary loss of coverage, it wasn't your fault. You can either switch to another Advantage plan available in your county, or you would be given guarantee issue, a small window of guarantee issue into a Medicare Supplement. Any loss of other credible coverage provides you that opportunity. The second most common way you might have a special enrollment period when you have an Advantage plan is through what they call the test drive. The test drive for Advantage plans is designed to give people an opportunity to try an Advantage plan out without being locked into it for life. Advantage plans work very well for some people, but they're not for everybody. But because they can be so attractive, a lot of people want to try them out. The test drive provides you an opportunity to enroll in an Advantage plan and try it out for up to 12 months. If you decide at any point within that 12-month window that that's not the plan for you, that's not the kind of coverage for you, you can drop that plan, even if it's not during an enrollment period, because you're in your test drive. You can drop that plan and have guarantee issue into a Medicare Supplement. Now, this test drive is only applicable to people who are turning 65 and becoming eligible for Medicare. It does not, unfortunately, apply to people who are under 65. And you can use it one of two ways. You can either take the test drive when you first become enrolled in Medicare A and B, and you go straight into an Advantage plan, and you test drive it up to 12 months. If you decide at any point within that 12 months it's not for you, you can drop it and still have guarantee issue into a supplement. So basically, if you test drive the Advantage plan out when you first get Medicare, it can almost just basically extend your guarantee issue into a supplement for almost a year instead of that limited 6-month window. The other way you can take advantage of the test drive is if you enroll in a supplement when you first get Medicare, and you maintain enrollment in a supplement without any break in coverage for however long. And at some point down the road, you decide you want to try an Advantage plan. You can drop your supplement, enroll in an Advantage plan during an open enrollment window, October 15th through December 7th, have that 12 months to test drive it come January 1st when that plan would go into effect. And if at any time during that 12 months you decided that's not for you, you can drop it and have guaranteed back into the supplement that you dropped. So those are the two ways that you can use the test drive for Advantage plans. Any questions about any of that? Okay. Medicare Advantage plans work completely differently than Medicare Supplements. But remember, you still have to pay your Medicare Part B premium. Nobody gets out of that. Nobody gets away with not having to pay that. But many of these plans do have little or no monthly premium to be enrolled in the Advantage plan. However, the way the plan works as far as paying benefits is totally different than having Medicare with a supplement, and you will have out-of-pocket costs in the form of co-pays, co-insurance, and possibly deductibles. Again, any type of Advantage plan, it must provide you any and all Medicare coverage services, but you get them through the plan. Most plans will include that Part D prescription drug coverage rolled into the package at no extra cost. But you may be limited to what doctors or providers or facilities you can use based on that plan. However, in an emergency situation, you would be covered by that plan anywhere in the US. But again, benefits and cost sharing do work differently than original Medicare and a supplement. And just to make things a little more interesting, there are several different types of Advantage plans to choose from. There are HMOs, Ppos, private fee-for-service plans, special needs plans. The best way to get a complete listing of Advantage plans available in Colorado or available in your specific region or area would be to call 1-800-Medicare and request that they mail you a Medicare new handbook, like I talked about last week, specific for Colorado. At the back of that Medicare new handbook for Colorado, it lists all the Advantage plans available, lists all the drug plans available, it lists all the special needs plans available in Colorado based on region or county. The other way that you would be able to get specific information about what plans are available in your county specifically would be to go to Medicare.gov website and use their plan finder, which I'll talk about a little bit more as we go. Additional types of Medicare Advantage plans are going to be Medicare savings accounts. Unfortunately, we don't have any of those available in Colorado. Medicare cost plans, I'm not going to talk about very much because they're being sunsetted or phased out by Medicare. We currently do not have any demonstration or pilot programs running in Colorado, but we do have a program for all-inclusive care of the elderly, also referred to as PACE, which we will talk about a little bit. So we're going to go through each type of Advantage plan real quick, just so that you get a feel for the differences between the different types of plans. We're going to start with HMOs. If anybody's ever been enrolled in an HMO or had to use an HMO through an employer or what have you, you know what I mean when I say an HMO is an HMO is an HMO. They all work the same way. When you are enrolled in an HMO, Advantage plan, HMO or otherwise, generally you must stay in network, meaning you must get your care and services from the network of providers and facilities that specific insurance company has contracted with. For all intents and purposes, when it comes to Medicare Advantage plan, your service area or your network area is going to be your county of residence. So whatever providers that plan has contracted with in your county. In HMOs, you are likely to require referrals to see specialists or for some services. You are likely to require prior authorization for some services. If you go out of network for services, you will be stuck with paying the full cost of that care because neither the plan nor Medicare will cover that cost. Again, except outside of an emergency. If you are anywhere in this country and you have an emergency or urgently needed need for care, the plan will cover it. And HMOs do include Part D benefits. These are considered the most restrictive Advantage plans. Then there's PPOs. PPOs basically work the same way. They have a network of providers and facility that they would contract with and they would prefer you use. But you are allowed to go out of network in a PPO. So they have a network of providers and facilities they would prefer you to use, but they don't limit you to that network. Because you are allowed to go out of network, referrals are not required to see specialists, although you may still need to get prior authorization for some services. You're not required to get a referral to see an out-of-network provider, but you will likely pay a higher copay to see out-of-network providers versus seeing in-network contracted providers. PPOs can or cannot include Part D. If you enroll in a PPO that does not include a drug benefit, you will hopefully have a good reason for doing so, such as you use the VA pharmacy or something like that, because you would not be allowed to enroll in a separate drug plan in that situation. You would either enroll in a PPO that includes a drug benefit or have a reason for not needing that drug benefit. Fee-for-service plans are the most flexible Advantage plans. They tend to have no network of contracted providers and facilities. You are allowed to go to any provider or facility that agrees to accept your plan. What that means is you can typically get services anywhere outside of even your service area or county of residence. No referrals are required, although there may still be prior authorization required for some high-cost services. But the plan sets the copays, what they're going to pay the provider, and what you're going to pay in copay. The downside to fee-for-service plans is that it now becomes your responsibility to make sure that you can find a provider that will accept this plan. The plan's payment and your copayment is payment in full. Because there are no contracts for a network of providers with these kinds of plans, even if you can find a provider that's willing to accept it the first time, that does not mean they have to accept you as a patient the second time. There's no contract locking them into taking this coverage. They can choose on a day-to-day or case-to-case basis whether or not they want to accept you as a patient with that coverage. If you enroll in a fee-for-service plan that does not include a drug benefit, you would be allowed to enroll in a separate Part D plan so that you have drug coverage, or you would want to have a good reason not to have the need for Part D through that plan, such as you use the VA pharmacy again. So again, this plan has the most flexibility, but it can be a little bit harder to find providers willing to take it. And it becomes your responsibility to do so, or versus an HMO, they have a network of providers they've contracted with. If you need a provider, you call them up, they tell you who you can go to. Special needs plans, Advantage plans, are a type of Advantage plan that's designed specifically for specific populations. And typically that's going to be the population of people with Medicare who are also eligible for Medicaid, or who reside in certain long-term care institutions or facilities, or have qualifying chronic health conditions. Advantage plans, special needs Advantage plans are not available in all areas. And again, you can either go to the Medicare.gov website's plan finder or reference the Medicare New Handbook to get a complete listing of what special needs plans may or may not be available in your area. I mentioned Medicare cost plans are being sunsetted or phased out by Medicare. So I'm not really going to talk about them at this time because they will be phased out by the end of this year, I believe. We do have a PACE program in the El Paso County area, and as well as basically the Front Range. of Colorado has PACE programs. Basically, a PACE program works very much like an HMO type Advantage plan, but it's like an HMO on steroids. And it's, again, designed for a very specific population of people who have Medicare and Medicaid. And the reason it's like an HMO on steroids is because it does provide much more case management. So in a PACE program, they are really going to manage your care much more closely by providing case managers. They're going to work with you on a close and personal basis to make sure that you are receiving services that you need so that you can stay in the community and in your home. It is an HMO in regards that you need to stay in their network of providers and facilities for services. But again, it's going to be more specific for people with Medicare and Medicaid. The thing to remember about Advantage plans is that you can get an Advantage plan at little or no monthly extra cost, as long as you're paying your Part B premium. But in exchange for that little or no monthly extra cost in premiums, you will have copays and coinsurance and possibly deductibles with these plans. So you may have no monthly premium, but every time you need service or need care, you will have an out-of-pocket cost for that care. And that's versus a Medicare supplement where you pay a higher monthly premium, a much higher monthly premium, $100+ a month. But when you go for services, you pay nothing typically out of pocket, depending on the level of coverage that you choose. When you are in an Advantage plan, you still have all the rights and protections of original Medicare, but you have some additional rights in Medicare Advantage plan, such as the right to have access to healthcare providers. They have to make sure you have providers available to you that will take that plan in most cases. You have the right to know how those doctors get paid. Fair, efficient, and timely appeal processes, especially in certain healthcare settings, are your right. You have the right to get the care you need. You have the right to information about that plan and their benefits and coverage in easy to understand language. And of course, you have the right to have your personal medical information kept private. That was a lot of info. Any questions about that so far? That was a lot of information to cover in a very short amount of time. No questions about Medicare Advantage plans at all. All right. Oh, I do have a question in the chat box. Does that limit travel coverage? Okay, so Advantage plans do provide a travel, I'm not going to call it a benefit because it pretty much can work the same way for foreign travel as the supplements do. But again, if you are in an Advantage plan and you are traveling, you're visiting family, you're on vacation, what have you, it will provide coverage in a medical or urgent medical needs scenario. If you are simply traveling or visiting family for an extended period of time and you just want to go see a regular doctor because you're getting allergies or something, that would not be covered because you'd be outside of your service area. But if you have a medical emergency or urgent medical need, the plan would have to cover you no matter where you're at. So hopefully that answers that question. Okay. So obviously the differences between Medicare Advantage plans and Medicare supplements can be pretty big. That's a lot of information to take in, and it can be somewhat confusing. Medicare Advantage plans in particular have become much more confusing, especially in the last few years, as these different types of plans have become more prevalent. 5 years ago, there were a handful of Advantage plans to choose from. Today, there are almost 30. And each one of them work very similar, but are different. Because of the confusion, because of the mass marketing, I'm sure you've all seen the commercial on TV with Joe Namath or the comedian, the Jeff Foxworthy guy comedian, talk about Medicare Advantage plans. And everything they have to say make them sound like the most wonderful thing in the world that provides you all these benefits you didn't know you had. But that kind of advertising can be somewhat misleading. And so there's a lot of confusion about these plans. So I wanted to go over real quickly some of the things that Advantage plan agents, people who are selling these kinds of coverages, can and cannot do, and what the companies can and cannot do with regards to marketing, specifically for Advantage plans. So these are the do's and don'ts. Things that cannot happen when someone wants to sell you an Advantage plan. Agents, brokers cannot approach you in common areas such as parking lots, sidewalks, lobbies, or hallways. They cannot send unsolicited text or make unsolicited phone calls to you for these products. However, they can send emails initially, as long as that email has an opt-out option, meaning you can click this link and opt out so they can never send you an email again. And they can mail, snail mail, print material. We get advertisements in the mail all the time. They're allowed to mail advertisements. They cannot ever use the term free to describe zero premium policies or plans, or to describe reductions in deductibles or cost sharing. They cannot require anybody who wants to attend an informational presentation to sign in, when whether either for education or marketing events. They cannot make you sign in and provide your contact information. They cannot camp out in providers' offices. So they cannot have a table set up in your doctor's office or even in the medical building that your doctor's office is at. They cannot do that. Other things they cannot do is represent themselves to the beneficiary, nor can the company misrepresent themselves. And that would include suggesting that Medicare endorses them specifically, or that they represent Medicare in any way. They cannot conduct marketing if they're providing an educational presentation. So if an insurance agent has sent you a mailer saying, I want to do a Medicare 101, please attend. And then during that presentation or whatnot, they try and market the insurance that they sell, that's a no-no. However, that becomes a pretty gray area because they can hold a marketing or sales event immediately following that educational presentation, meaning they can have a table outside the door of that presentation so that as you're leaving, they can start the marketing part. They cannot provide meals at marketing events, although they can provide light refreshments. They cannot offer free services or gifts worth more than $15. And the gift would have to be available to anybody who attended, not just somebody who enrolls. They cannot go door to door. They cannot get their foot in the door at a housing complex or apartment complex and put flyers on everybody's door. They cannot do that. They cannot knock on your door without being invited, period. Because all of these things have happened is why we have all of these rules. So I want you to be aware that there are many things that these companies and agents cannot do to try and get you to hear them out about what they're trying to sell. All marketing material must be approved by Medicare directly. They must comply with do not call lists, and they must obtain permission to contact you in some form or fashion. And even if you agree to meet with them, they can only talk about one topic at a time. So if you are talking to an agent that sells Advantage plans and supplements and drug plans and life insurance and annuities and all of those kinds of things, if you have set an appointment to talk to them about Advantage plans, that's all they can talk to you about. And they would have to set another appointment to talk to you about any other products that they sell. I emailed, in the email that I sent earlier, I included some additional information about these do's and don'ts and what they can and cannot do. So let's wrap it up. When comparing Medicare Advantage plans, there are a couple of questions I want you to ask yourself before you sign on that dotted line. First and foremost, if you're enrolling in an Advantage plan that includes a drug benefit, Part D, please make sure that that plan specifically covers your specific medications. Just because a plan includes a drug benefit does not mean it covers your drugs. And we get into this a lot more deeply when we talk about Part D next week. But every plan that has or offers Part D coverage may sell or may offer a slightly different list of covered drugs. So you want to make sure specifically that your drugs are covered by that plan. If you have a primary care provider and you want to keep that provider, ask that provider first whether or not they take the plan that you are considering. If you enroll in a plan without checking with your providers first and you want to keep those providers, but you enroll in a plan and that plan has not contracted that provider, you can no longer see that provider unless you want to pay out of pocket. If you have a preference of healthcare network, I know in El Paso County specifically, we have 2 primary healthcare networks, Penrose St. Francis and UC Health. If you have a preference, check with the plan to see which network they have decided to contract with. Some of them contract with both, some of them do not. If you doctor a lot or see specialists a lot, check with the plan as to whether or not you're going to be required to get a referral every time you want to see the specialist. Some plans may require that, some plans may not. Those are just a few of the questions that you need to ask yourself before you enroll in this kind of plan, or to ask yourself to try and determine if this is the kind of plan that might work best for you. Any health issues or any questions you may have related to how you receive your healthcare benefits or services are questions you want to ask any plan that you're interested in enrolling in or talking about, period. Do not go in without asking lots and lots of questions and having a clear understanding of what this plan may or may not provide for you. Again, I emailed you some additional information about these kinds of this kind of coverage. The first handout, again, is put out by the Division of Insurance up in Denver, and it just basically gives you the basic overview, which we just covered, of the different kinds of plans with some pros and cons. So a very handy handout to have. I've also included this handout. This was put together by one of my most wonderful volunteers who unfortunately has left us. So I think I'm going to be doing this come next open enrollment. But what she has done here is she has put together basically an at-a-glance sheet that lists all the Advantage plans available in El Paso County for 2021. It tells you the name of the plan. It tells you what kind of plan it is, what the monthly premium is, whether or not it has deductibles, copay ranges for the most common services. And yes, it even tells you what hospital network that plan is contracted with. Wonderful, wonderful handout so that you can compare the different plans all in one glance. I also have one for Teller County. Unfortunately, those are the only 2 counties we currently do this for. As I talked about briefly last week, there are also programs available through the government to provide assistance, financial assistance for people who have limited or low incomes to help cover the cost of your Medicare. So the Medicare savings programs are designed to help cover the cost of your Medicare Part B premium if you are in lower limited income based on these specific income ranges. These are in gross monthly dollars, total income, pre-deduction income, and the asset limit is in total cashable liquidatable assets. Asset limit does not include your home or the property it sits on, your primary vehicle, your personal possessions. It only looks at liquidatable resources such as bank accounts, investments, property you don't live on, etc. If anybody wants any additional information about this assistance, we do help with these applications, and we're happy to talk to you in more detail about eligibility and benefits of these programs. And that is it. That is all I have for you this week. Any final questions?
Yes, you said to remind you to address how para works with all this.
Thank you. So For para retirees, what para currently offers are two options. They offer an Anthem PPO, and they offer a couple of Advantage plans. I don't know if it's two or just one now, actual HMO type Advantage plans. The thing with para and the thing with any retiree plan, whether it's government, public employee, private, anytime an employer is offering a Medicare customized benefit, you got to remember the word customized. So the para PPO with Anthem basically works like a PPO, like I talked about, where they have a network of providers that they have contracted with that, they would technically prefer you use. However, the way para has designed that PPO allows anybody who enrolls in it with Medicare to go to any provider that accepts original Medicare as coverage. And as long as that provider is willing to accept the Anthem plan, you can use that provider and that plan will pay that provider. There are usually no copays depending on which level of coverage you get with the Anthem plan, option 1 or option 2. If you go with option 1, there are no copays. If you go with option 2, there might be some small copays. But there's not really a network that you're limited to. So ultimately, it works more like a supplement in that you don't usually have to pay anything out of pocket if you go with option 1. But it is technically considered a PPO Advantage plan. So it's kind of a hybrid of both, which makes it a little more confusing to explain. And then of course they offer the other option, which is actual a Medicare HMO type plan that works very much like the HMO I talked about. You're limited to a network of providers and facilities. You pay copays for all services. Now, if you compare the para HMO to a standard HMO available through Medicare, the para HMO provides much better coverage at lower cost and what's considered much better drug coverage. The Anthem PPO through para also includes drug coverage that's considered much better than Medicare's drug coverage. So in either of those scenarios, you would not have to worry about getting a Part D. If you went with para and any of the para retirement insurance options, you would not need any other coverage because those options are considered credible. And you would not need to worry about enrolling in anything else. Now, if you were to drop that coverage down the road or lose that coverage for some reason down the road, again, you would have a special enrollment opportunity with guarantee issue either into a Medicare supplement based on the loss of that coverage, or you'd be able to get into an Advantage plan that we talked about based on the loss of that coverage.
So even if the reason that you drop it is voluntary, you could go back to a Medigap plan?
In the state of Colorado, we have an additional provision in our law that allows that, whether it's voluntary or involuntary. The difference would be the time frame you have to take advantage of that. So if you voluntarily lose other coverage, other credible coverage, you have a 63-day window of guarantee issue. If it's involuntary, you get a 6-month window of guarantee issue.
I have one more question. Sorry to kind of monopolize here.
You're fine.
I looked at, for example, Kaiser isn't the HMO, okay? I looked at Kaiser Para and I looked at Kaiser just straight, Advantage. And the coverage looks so similar, but the Para costs considerably more. Or is there kind of a hidden coverage there, primarily in drugs that I'm not seeing just from the little cheat sheets of them?
Yes, so the drug coverage again is going to be considered much better than Medicare Part D or what would be covered in a Kaiser Advantage plan, standard Advantage plan. Also, when you look closer at the copays, typically your copays are going to be lower for the more expensive services with para than they would be through the standard Kaiser Advantage plan. So if you look at the inpatient hospital copay, versus the para Kaiser is probably going to come in at a lower out-of-pocket. The out-of-pocket maximum through para is much lower typically than the standardized Kaiser HMO. So there are some advantages to staying in that para coverage, even though it can be more expensive. Not to mention the other advantage, and this is what I was going to say, when you have a retirement benefit, through something like para or the federal retiree program or even a private employer. One of the key benefits of that coverage is the ability to have the potential to make changes to that coverage from year to year. So para, their options have become a little more limited, but you still have the option of going either with their HMO or their PPO option, and they have different levels of coverage for both. If you're a federal retiree, they have a whole wide range of different insurance companies you can go with. Even private employers sometimes offer different options that you can choose from. In a retirement benefit system, you have the ability to make changes if they're available from year to year without restriction. When you are when you're not in a retiree system, those options can be more limited. That ability can be more limited.
One last question. Would you say that the Anthem PPO is comparable to the F plan on regular supplemental? I would be eligible for that when I finally decide to retire.
If I need to equate it to Medicare Supplement and coverage, probably, because it would cover your deductibles for both A and B. So it would most closely relate to a supplement plan F, yes.
Thank you so much. I appreciate it.
You're welcome. Any other questions? Don't forget, we are also your local S&P office, which is the program designed to help educate and empower people to protect, detect, and report potential fraud and abuse, errors, questions or concerns that you have about any of your Medicare and or Medicaid claims or services. We are always also looking for volunteers. Here's my contact information and the contact information for our office and the local program for the 9 counties that we serve. But again, keep in mind, every county of every state in this country should have access to a SHIP office for this free unbiased assistance and education, at least through a toll-free statewide number. I'm always happy to answer any questions. Emailing questions is best, and you can always reach me at that email address listed, seniorinsure@ppacg.org. Or you can call our local number at 635-4891. We do have 5 full-time counselors and a couple of part-time volunteers who are all thoroughly trained and certified by both Medicare and the state of Colorado, all fully qualified to assist you. So if you're unable to get me on the phone, email me, or you're more than welcome to talk to any of my other counselors. They're all well qualified and well trained. I should know, I train them myself. And that's it. Hopefully I will see you, or not necessarily see you, but hopefully I will see you all next week for Medicare Part D, or Part 3 of 4-part series of Medicare 101. I appreciate your patience tonight. I know it's been a long session, ran over time a little bit, but again, it's a lot of information. Please let me know if you have any additional questions. I'm happy to answer them. And if there are no other questions or comments, I'm going to let you all go.
Thank you so much. This is so helpful.
You are most welcome. All right. I hope you all have a wonderful evening, and I'll see you next week.